Hello there. Are you on the low-FODMAP diet and feeling down or as weak as a kitten? Or are you thinking of starting the diet and wondering if it can cause fatigue? If yes, then you're watching the right video. In this video, we will be finding scientific answers to the following questions. Can the low-FODMAP diet make you tired? Can it help with fatigue? Is there any risk of the diet causing fatigue? In what ways and what can you do? So then, can the low-FODMAP diet make you tired? Let's explore the science. We start with a research article published in 2019. There, the effect of the low-FODMAP diet on patients was reviewed, particularly the effect on their quality of life. The study was done over 6 months. It was concluded the low-FODMAP diet was associated with reduced fatigue. Apparently, the diet resulted in less fatigue in the patients. Let's go to a review research article in 2018. This paper examined the effect of a low-FODMAP diet, specifically on non-celiac gluten sensitivity, or NCGS. It noted FODMAPs may be a causative factor in symptoms such as fatigue and loss of vitality, meaning having normal to high FODMAP content in diet could be bad. We discussed this in another video in this project. Is a low-FODMAP diet good for Crohn's disease? Is it worth mentioning that other studies agree? One study found fructans to induce symptoms. Now, the most abundant FODMAPs in the wheat grain are fructans. So fructans are FODMAPs and cause symptoms. The 2018 paper then continued, fatigue improved significantly with a FODMAP-free period. This shows that the removal of FODMAPs from the diet over the short period helped. To another paper that is related to our topic, a 2021 clinical practice guideline reviewed a topic, the management of chronic multi-symptom illness, or CMI. Now get it, CMI is characterized by multiple persistent symptoms, that is, fatigue. This means fatigue is a symptom of CMI. The guideline then noted low FODMAP diet. This is under treatment of CMI and symptoms consistent with IBS. What is IBS? Irritable bowel syndrome. So this guideline acknowledges that a low FODMAP diet actually helps with fatigue. A systematic review paper published in 2018 touched in this question. It considered current evidence regarding the benefit of a low FODMAP diet. It noted that there was a significant improvement in fatigue. Summarily, the paper shows a low FODMAP diet helps with fatigue. This is good news. A 2020 article was published on the effect of a low FODMAP diet, specifically on IBS. 73 patients were recruited for this study. In the end, there was a note about the effect of the low FODMAP diet on depression. The LFD was effective in improving depression. Now, fatigue is related to depression. Studies have shown fatigue could be a residual symptom of depression. So, if the low FODMAP diet can improve depression, it can be helpful for fatigue. But one might ask, why might a low FODMAP diet help with depression-related fatigue? A research paper on IBS and the low FODMAP diet touched on this. It noted major mechanistic pathways via which FODMAPs induce symptoms in IBS. It then remarked on one, especially concluding that this pathway can be attributed to depression. So this study confirms that FODMAPs in the diet of IBS patients could cause depression. A low FODMAP diet reduces FODMAPs in your IBS diet, so it may help with the fatigue part of depression. Another study done on 20 patients noted the same. The study was done at a research hospital in Italy. It confirmed that depression reduced after LFD, or a low FODMAP diet, though depression scores showed only a trend toward significance. This means that the improvement in this particular study was not so obvious. So far, the scientific evidence has been suggestive of some things. 1. They appear to show that the low FODMAP diet is beneficial long-term. They also appear to show that the low FODMAP diet actually can improve fatigue, particularly in properly selected patients. If you think you have found really good research so far, please like and subscribe. We are always trying to get the latest research on the low FODMAP outline. We would love to hear from you about your experiences with the low FODMAP diet and fatigue in the comments section. Now let's talk about risks. Are there risks that can predispose to fatigue if using the low FODMAP diet? A research paper reviewed various risks of the low FODMAP diet. First, the paper mentioned inappropriate use of the low FODMAP diet. It noted the low FODMAP diet should be implemented in the appropriate setting. Second, It mentioned altered gastrointestinal microbiota. This means the low FODMAP diet can change the normal bacteria in your gut. Of course, it is noted that this has not been considered a major issue so far. Why? Adherence to a strict low FODMAP diet is only recommended for 2 to 6 weeks. But can it cause an issue? A study was done on 88 cancer patients. It examined the relationship between gut bacteria and fatigue. It concluded this: different levels of fatigue can have distinct gut microbiome compositions. Another study findings suggest that fatigue could be defined by distinct bacterial communities. Simply put, the evidence suggested fatigue could be influenced by your gut bacteria. Therefore, probably best not to be strict on the low FODMAP diet for long, since long-term health effects of a low FODMAP diet are not known. So best to be careful. Third, the paper noted disordered eating. People who undergo dietary change may be at risk for disordered eating behaviors. Now we know that fatigue is one of the symptoms of eating disorders. Particularly then, please be wary when having fatigue on a low FODMAP diet. It might just be an eating disorder. So far, we have discussed some interesting evidence. Evidence on the fatigue you're feeling. It may not be caused by the low FODMAP diet at all. It may be caused by an eating disorder. It may also be caused by a change in the bacteria in your gut. But are these things in the low FODMAP diet that can potentially cause fatigue? Maybe low carbohydrate intake. Maybe low iron. Let's examine the science. A research paper published in 2017 touched on this. It noted this: a low FODMAP diet imposes an important restriction of dietary choices. It then mentioned a risk of reduced intake of iron as a possible result. Now, iron is needed for oxygen delivery and energy production. One research paper noted this: iron is involved in oxygen transportation and energy formation. If there is reduced iron intake in the diet, energy drops. If energy drops, fatigue results. Consequently, please ensure your iron intake is optimal if you're on the low FODMAP diet. This will prevent or fight fatigue. What about low carbohydrate intake? Let's move. A study published in 2020 noticed this in the low FODMAP diet. The exclusion of carbohydrates rich in fructans may lead to reduction in carbohydrate intake. In plain English, cutting out so many FODMAP foods could be bad. It could mean fewer carbohydrates are eaten. The paper found lower energy and lower carbohydrate intake in 33 patients treated with LFD. So it is important to keep one's carbohydrate intake normal, even while on a low FODMAP diet. This can also fight fatigue. Some good news though, most of these problems are in patients who follow the diet without clear professional advice. This means they can easily be resolved with the presence of a skilled nutritionist. In simple terms, with professional help, the low FODMAP diet won't have these issues. There's no need to fear. In this video, we have together gone on a trip to unravel science-based checks on a question: can the low FODMAP diet make you tired? From the research that we have reviewed so far, the facts are clear. You can only become tired for specific reasons. Either you aren't eating a balanced enough diet, which is then causing reduced energy production, or you are misusing the low FODMAP diet. These problems can be resolved by contacting a health professional. So whether you're as weak as a kitten or tired or fatigued, there's something here for you. So discuss this with your doctor or dietitian before changing any part of your diet. If you've enjoyed this video, please like and subscribe. We would also love to hear your thoughts and questions in the comment section. Also, you may like the video where we discuss another topic in this project. Is the low FODMAP diet gluten-free? You can also watch the entire low FODMAP diet playlist via the link in the description. Thank you, and I hope to see you again.